As lockdowns continue to ease in several countries, which have been able to flatten the COVID-19 curve, they are now trying to transition to their new normal. And one solution being tested is having people create social bubbles.
The goal is to make sure that they remain very low risk for COVID, but also to mentally support people from isolation, from getting back to some semblance of old life.
Many countries like Belgium, New Zealand, England, Scotland, and Canada are allowing individuals to create small group sizes who are allowed to hang out as often as they'd like and can even go in for a hug. But here's the catch. Social bubbles are exclusive, so you can only be a part of one, meaning those within the group have to agree to practice safe hygiene, physical distancing, and to wear face coverings where required outside of their bubble.
What we can see now, this idea of forming bubbles or forming small micro-communities would be probably the safest in terms of curbing disease spread.
Although the concept of social bubbles is being practiced in several parts of the world, many people still have questions, like how safe social bubbles really are, and do they actually work?
What we can say is that we have sound theoretical and simulation-based evidence that it's much safer to use social bubbles compared to socializing as we did before the lockdown started.
If one of those 10 people puts themselves at risk, in the sense that they, again, aren't physically distancing, or they're around people that could have COVID, that aren't protecting themselves, if they stay in very close contact with these other 10 people, they almost take it back to them in that sense.
The challenging part comes when people head back to work.
Because adults do a better job at physically distancing, socially distancing, wearing a mask, that type of thing. And so that shouldn't be an exclusion to being within that bubble, as long as people are very, very careful.
It can be even trickier for adults with young kids going to daycare or school.
A child in school who's at an age where they can't wear a mask in distance or in daycare, it would be very tricky to make a bubble with that group, because you then have extra risks from that child. Even though that child may not get sick, they may bring it back into the bubble.
In the case where a person participating in a social bubble develops COVID-19 symptoms, Chagla recommends getting a test. If the tests are negative, then the person can go back to their bubble once they're well. If tests are positive, then the entire bubble will need to isolate for 14 days if they've been in close proximity with the person who has COVID-19. Chagla and Block both say the concept of social bubbles is quite new. Other variations of it may have been practiced in the past, but under very different circumstances. So if we want concrete proof that they actually work, we'll have to wait and see if countries implementing social bubbles continue to see a decline in coronavirus case numbers. Thanks for watching Global News. If you want to stay up to date on the latest breaking national and international news, be sure to subscribe to our channel.